Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here for Gold Learning. And today I have a special guest with me, and it is Dr. Fayrouz Essawy. And we're going to chat with her about your upcoming presentation here at Gold. Welcome, Fayrouz.
Hello, Kristen.
It's lovely to have you here. And oh my goodness, it's wonderful to have you here. We have our neonatal conference coming up very soon here at Gold, and you are part of a special lecture pack that we are preparing here. And the lecture pack is titled Advancing Human Milk and Breastfeeding Practices in the NICU. It's wonderful, the work you are doing there in the hospitals with these little vulnerable ones. So tell us, first of all, a little bit about yourself. Where in the world are you located?
I live in Egypt, particularly in Cairo.
Oh, that's wonderful. So you work for a hospital there, right, in Cairo?
Yes.
So tell us a
Yes.
little bit about your background.
I am a neonatology consultant and the Egyptian neonatology fellowship trainer. I have been a lactation consultant since 2015. I also work as an IBCLC in Rufaida Maternity Hospital. And I am also a trainer and mentor in the Lactation Consultancy Comprehensive course provided by the Egyptian Lactation Consultant Association, preparing candidates to set the IBCLC exam since 2016.
Oh, wonderful. So you're very busy for it sounds like.
Yes. I work in two hospitals, the one as a neonatology consultant and the other as the international board lactation consultant.
Beautiful. What is a neonatology consultant? What is that? Can you describe that a little bit for us?
Neonatology consultant is is a pediatrician which works with the babies in the neonatal age in the first 30 days of their starting life.
Oh, perfect. Yeah.
We work with preterm and vulnerable disease babies.
Beautiful. Thank you for sharing that. Now, you're also an expert, of course, in breast and chest feeding. Can I ask you, what are and this is not in the neonatal units, just in general, do you know what the breastfeeding rates in Egypt are in general?
The breastfeeding rates, we support mothers to breastfeed in the first six months exclusively and to continue breastfeeding till 2 years. We have the Ministry of Health to support the mothers, and we have many communities support groups to help mothers also.
But so you feel like there's access to support from others that's available? Would you say that there's quite a little bit of support available for the mothers there in Egypt?
Yes, we do great work now through the Ministry of Health and through our free work as volunteers.
Yes, absolutely. So let's talk about the NICU now. That's your area of expertise. So with the little vulnerable ones, and it's fascinating, the research that we have nowadays about how breast milk or human milk, how beneficial that is. All the things that can, even for the little ones, how much they really need to have access to human milk, right?
Yes. Breast milk is a gold standard in NICUs. It is very important for preterm babies and for vulnerable babies. Through our work in the NICU, we reach that babies who receive breast milk go home early, and less of them get to readmitted to the hospital again. They have less morbidity and mortality than babies on artificial feeds.
That's absolutely beautiful. So you're supporting, of course, parents and mothers to breastfeed, to pump, to assist with that, of course, as well.
Yes,
and go ahead, describe that a little, how that works in your unit.
Yes, in the NICU, we have interview with the mothers during the first days. She enters the NICU and counseling her about expressing her breast milk and give her instruction about the pumping methods of hand pumping and using a pump, and help her to buy a suitable pump for her condition and her baby, and educate her how to hand express for the first 2 days, then to combine with pump to reach the goal of 750 milliliter to 1000 milliliter by reaching 1 week or 10 days postpartum. Also, we educate her how to store the breast milk and the containers she can use, and how to bring it to the NICU, and prepare her to avoid contamination of the milk in order to decrease the risk of contamination of the milk, so we can use it in the hospital without any worry.
Yeah, and that is especially important for the little ones in the NICU. Not that, of course, it needs to be, it's important for any aged human infant that the milk is not contaminated, but especially for these little ones that are so vulnerable, right?
Yes, because especially preterm babies, they are more prone for necrotizing enterocolitis, and breast milk help to overcome this problem in the NICU and to decrease sepsis, especially onset sepsis.
Absolutely wonderful. Is there, and I don't know if you know this, but is there any prenatal education available for parents to kind of who know that they might have a baby in the NICU? Not everybody, of course, knows there's unforeseen circumstances, of course, that they are preparing for breastfeeding and pumping. So they're educated, or how does that work?
Till now, we have a prenatal classes for every mother. In the last 3 months of pregnancy, we talk with them about breastfeeding, the importance of breast milk and the breastfeeding position, the golden hour skin to skin contact with the baby, and we also stress on pumping. In case of the baby admitted to the NICU, she should come again and take a lesson or a small class to teach her how to pump and store her breast milk.
Wonderful. That's great. Education is so important. Is your facility a baby-friendly hospital, baby-friendly initiative?
No, hospital? Unfortunately, no. The Rufaida Maternity Hospital, we have the IBCLC Care Award this year.
Yeah, wonderful. Congratulations.
Yes. And we prepare for the accreditation of baby-friendly hospital initiative in the coming months.
Beautiful. That's wonderful. Good news there. It's looking great. It's looking great. How about training of staff? Sometimes we hear about facilities where, let's say, a pediatrician and nurses are not necessarily well informed about breast milk and the properties of breast milk and the importance of, in assisting in breast and chest feeding. So, but it sounds like you have staff available to you, and they are trained to also assist with the situation, correct?
Yes, you are great. You are right. One of the obstacles I met when I start training and breastfeeding education in my neonatal unit and in the hospital is the resistance of the staff. They feel no, formula is good. Breast milk, it's hard to use breast milk, doctor. When they have the topics teach it to them, and they have the knowledge, and they know the importance of breast milk, and they found the results on the babies. They now help the mothers with us and doing great job. They now tell every mother,
everybody,
yes. Please come and join our lactation consultant and learn how to express and bring your breast milk to our facility. They after training, they have a great impact on the successful of introduction of breast milk and using the milk in the NICU.
Beautiful. And in case there is the parent, the mother is not able to provide breast milk because of medical circumstances or whatever, is there donor milk available for these little ones then?
No, as we are a Muslim countries.
Oh, so that
Uh,
is not, yeah, okay.
yes, but we can little bit do in informal milk sharing between mothers.
Okay.
But the donor should have investigation like to investigate for hepatitis C, hepatitis B, and HIV. But we don't have milk banking or the availability of pasteurization of breast milk in our NICUs.
Well, thank
So
you for sharing that. Yeah.
if unavailable, so we have milk from another mother or giving unfortunately formula.
Yeah. Okay. Well, thank you for clarifying that. So yeah, your topic, the presentation you are having here with us at Gold is titled NICU Practices for Storage and Handling of Breast Milk. Just give us a little overview what we can look forward to, because we want everybody to come to this presentation and enjoy it. So tell us a little bit about it.
Okay, the lecture will cover and discuss how we can counsel parents about the infection control measures and the guidelines related to storage, handling, and transport of breast milk to babies in neonatal units. Also, we will learn more about different storage times for breast milk for preterm and disease neonates in the refrigerator and freezer and after defrosting. We will go through types of breast milk fortification and the storage guidelines for fortified breast milk. And finally, we will go through different feeding methods rather than bottle to deliver breast milk to neonates.
And I know you have some videos, very nice videos as well included. So
yes,
yeah.
it is from my NICU, and I train the nurses to use this method with the babies to be baby friendly to breastfeeding.
Beautiful. Well, Dr. Fayrouz Essawy, it was so nice of you to sit down with me here and talk to me about your NICU there in Egypt, in Cairo, and about the presentation. Thank you so very much.
Thank you for you, Kristen. Thank you.
And this is information now for our viewers. If you're interested in this lecture pack titled Advancing Human Milk and Breastfeeding Practices in the NICU, and about, of course, the presentation by Dr. Essawy, we invite you to go to goldlearning.com and also goldneonatal.com. At the moment, this will be an add-on package for the neonatal online conference here at Gold. So check that out as well. And we hope to see you at the conference. Thank you for watching, everyone. Bye-bye and have a lovely day.